The following UW360 story is made possible by the generous support of UW-Medicine Neurosciences Institute, a leader in providing expert care for neurological conditions, discovering novel treatments, and spearheading education of future clinicians. More at uwmedicine.org/NSI.
What do safer football helmets and treating patients with epilepsy have in common?
Those are arteries and veins.
They're examples of Neuroventures, taking neurological research from the UW-Medicine Neurosciences Institute out into the real world.
We've had 50 patents over the last 5 years, and we've developed 5 companies that are geared at helping patients in treating conditions, curing disease, making diagnoses that we couldn't make before.
Neuroventures is an environment in which I, as a researcher, can work intimately with the medical providers to perform research, development, and to commercialize devices that can help the medical doctors do their job better for their patients.
Pierre Mourad is a researcher and a neuro-entrepreneur whose ideas have led to the creation of companies. One of them started with a conversation with a pediatric neurosurgeon.
We have this problem in pediatric care. We put catheters inside people's brains. It's hard for us to know really where to aim. In a matter of a year and a half, we went from an idea over coffee to a prototype device. About 2 years after that first coffee conversation, we created a company. That has moved along, and we anticipate first human trials this year.
Other Neuroventures could lead to innovative treatments for patients with neurological disorders.
Ultrasound delivered through the skull, so completely non-invasive ultrasound, can alter brain function for therapeutic purposes. I have a grant from NIH to study this process, to try to see if this can help alleviate multiple sclerosis.
We're working on a passive implant that can treat epilepsy.
Neurosciences Institute pediatric neurosurgeon Samuel Bourad is one of the leaders in the development of Neuroventures innovation and big idea thinking.
I've been interested in technology around helmets, and specifically football helmets, to reduce the forces that a player would receive, and hopefully down the road reduce the risk of them getting a concussion.
The result was a collaboration with the UW Department of Mechanical Engineering and a prototype for a new helmet. Bourad co-founded a company called VICIS.
We don't want to just have science projects going on. We want to take the science and make it real. We're able to take the expertise and knowledge that's here on the clinical side and pair that up with engineering expertise, computer science expertise, and develop these things that have enormous value.
The expertise of the UW's neuro-entrepreneurs expands the influence of the UW-Medicine Neurosciences Institute far beyond campus. Clinicians and researchers hope it could change patient care around the world.